Yes, so welcome to our Get SFU Ready session for international graduate students, and a big congratulations on your acceptance to SFU. We're so happy that you've chosen SFU as part of your academic journey, and I hope your experience here exceeds your expectations.
I will start off with talk about the International Service for Students Office. We provide supports and non-academic advising services to all international students at SFU. When we say non-academic advising, this includes information about immigration, such as your study permit, visa, work permit, medical insurance, and transitional support and programming. We also support students who are new to Canadian culture, including newly arriving permanent residents, returning Canadian citizens, and refugees. Our office also provides information about various study abroad, exchange, and field schools opportunities. The ISS office also provides programming and events for SFU students and referrals to various community engagement opportunities. For academic related matters, please contact your department advisor or faculty advisor for assistance. Due to COVID-19, our in-person services are temporarily suspended, but we continue to provide support to students remotely via live chat, virtual appointments, email, or phone. Please visit our website listed here for the most up-to-date advising schedule and for more information on how to connect with us. I would also encourage you to familiarize yourself with our website, as this is a fantastic resource that includes welcome guides for new students, instruction guides for permit and visa applications, information about medical insurance, and information about our programs and events. We would also be very happy for you to attend our upcoming workshops. We'll be doing one session on travel consideration on August 7th, and the registration information can be found on the website listed on this slide.
Okay, so now we'll start talking about medical insurance at SFU. As international students, you must have medical insurance for the entire duration of your studies. If your family members are accompanying you, they should also have adequate medical insurance during their stay in Canada. In Canada, there are generally two types of insurance, primary insurance and secondary insurance. So, primary insurance covers medically required services such as doctor's visits, hospital services, testing, and any emergency services. Primary medical insurance is legally required for all residents of British Columbia, including international students, and is provided through the BC Medical Services Plan, or MSP for short. Secondary medical insurance generally covers extras that are not covered by primary medical insurance, such as dental services, vision care, prescription medication. Eligible SFU graduate students receive secondary medical insurance through the GSS Health and Dental Plan. Graduate students working as TAs may receive coverage through another provider as part of their employment contract.
So we'll talk about GARMI SFU plan, which is one of the primary insurance type. And GARMI SFU is a short-term primary medical insurance coverage. The goal of GARMI SFU is to help you transition while you are waiting for your BCMSP and to allow you have immediate access to medical services in Canada. As international students at SFU, you are automatically enrolled in GARMI SFU plan for your first term at SFU. Your coverage starts on September 1st, 2020 through till the end of December, and we will not enroll you in subsequent terms. The cost is $281 per term, and as some of you may have already seen it reflected in your account, it is included in your student fees. Electronic medical card will be mailed to your SFU email address at the beginning of the fall term, and you can enroll your dependent family members, such as your spouse, common law partner, and or children in your GuardMe plan with additional cost of $2.30 per person per day. If you have BCMSP, you can opt out online, and we'll be providing more information on opting out process later in this session. BCMSP is provincially covered primary medical insurance, and all students staying in BC for 6 months or longer are required to enroll under the Medicare Protection Act. Unlike GuardMe at SFU, this is not an automatic enrollment and cannot be done through SFU. If you are physically in BC and haven't done so already, please apply right away online, or you can apply as soon as you arrive in BC. For a new resident, you must fulfill the wait period of 2 to 3 months. To apply for BCMSP, your current study permit must be valid for a period of 6 or more months. If you have any dependents, they can be added to your plan when you apply. The cost for BCMSP is $75 per month for all study permit holders. You will receive invoice monthly by mail, and you can make payment online, by mail, by direct deposit, etc. This charge does not appear on your SFU student account, and you are responsible to make monthly payments. One important thing to note that your MSP coverage will expire with your study permit. And when you renew your study permit, you will need to renew your MSP coverage as well. Normally, you would renew your study permit first and then submit a copy of your renewed study permit to extend your MSP coverage. I'm going to talk about the GSS health and dental coverage, which is your secondary medical insurance. All SFU graduate students are automatically enrolled in the GSS benefits plan for every academic year. This is secondary medical insurance, meaning that this acts as an extension of primary insurance, and you need BCMSP or equivalent private plans such as GuardMe to use the GSS plan. Secondary medical insurance does not replace MSP or equivalent to primary health insurance. You can make changes to your plan, such as enrolling your dependents during the change of coverage period with additional cost. It is important to remember that you must renew their coverage each policy year as well. For students enrolled in the fall term, the total fee for the graduate benefit plan is $465 for 12 months of coverage. The cost of the plan will be automatically included in your tuition and other fees. I think most of you are curious about opting out process, as many of you are deciding to stay in your home countries. So you can opt out from GuardMe online after September 1st, once your GuardMe plan is activated. You can opt out by September 30th for full refund and by November 30th for a partial refund. To be eligible for a refund, you must not have used GuardMe. You can opt out of GuardMe if you already have BCMSP or if you are not physically in Canada during the fall term. You can submit outside of Canada opt-out form before September 30th. For more information on how to opt out and opt-out process, and also to access outside of Canada opt-out form, please visit the website listed here. But this can be done only after your plan is activated, so after September 1st. We have created this flow chart because the information can be quite confusing and overwhelming. To summarize the primary medical insurance at SFU, this chart is available on the website listed on this slide. And one important thing I want to note that is, if you opt out of the GuardMe plan because you will be outside of BC in fall 2020, when you plan to travel to Canada, you must contact us to learn about temporary medical insurance options, as we will not be automatically enrolling you onto GuardMe again. So please do remember to contact us. For the GSS health and dental plan, you can opt out or add dependents to your secondary medical insurance during the change of coverage period stated here on this slide. For this plan, you can only opt out if you have equivalent health and dental coverage in Canada. Opt-outs are only valid for the policy year, and you must opt out again every policy year. We are currently waiting to hear from the GSS to let us know what their decisions are on students who will be outside of Canada. For more information and details of your coverage and opt-out process, please visit GSS Student Care website. Due to the limited time we have today, I will briefly touch on these topics. If you are planning to physically arrive in BC before the fall term begins, please ensure that you purchase early arrival insurance to have adequate medical insurance coverage prior to September 1st. If you are working for SFU as a TA or TM, you will be applying for BCMSP in a different way. You will be submitting your application to the Human Resources Department at SFU, as the cost will be covered under your SFU employee benefits. These benefits are not automatic and you need to apply, and you can enroll any dependent family members joining you in the group plan. If you are no longer a TA in the future, you must pay for your own MSP. Please note, if you are a TA, you will still be automatically enrolled in the GuardMe at SFU primary medical insurance plan, and you must opt out manually. SFU will reimburse portion of GuardMe cost. Please make sure when completing MSP application form, notify the human resources team that you are covered by GuardMe. For TAs, you will be automatically enrolled in GSS student care as well as any other graduate students. And also you're eligible for additional health and dental plan through Pacific Blue Cross, which is offered by the TSSU. This plan is considered equivalent coverage and can be used to opt out of the GSS benefit plan. For further questions, please contact the HR or TSSU office. Back to you, Ricky.
Yes, so we want to give you an overview of services here at Health and Counseling. We have a team of doctors, psychologists, mental health nurses, and clinical counselors that are available to help you succeed during your academic time here. Our Health and Counseling service is open to any student who is registered at SFU. Our doctors can act as your family physician while you're here studying at SFU. Now, due to COVID-19, many of our services have now gone virtual and online. So it's by phone calls or by Zoom, and you can make appointments when you arrive in Canada by calling either our Burnaby or our Vancouver offices. To access our health services, you would need to have either GuardMe or MSP coverage to do so. Our mental health services are free of charge to any registered SFU students. We also want to let students know that due to jurisdiction issues, we can only provide services to students who are currently in British Columbia. So, as earlier I mentioned, I'm the transition case manager here at SFU Health and Counseling. I'm here to support students from international pathways and their transition to SFU. So transition can be many things, and here are some of the topics that I may be able to support students with: mental health, culture shock, family pressures, finances, education system, understanding the medical systems and services available, social and recreational support, intercultural communication, and Canadian labor market trends. You can book an appointment with me by calling the number on the slide, and then I can set up either a phone or a Zoom session with you as well. Lastly, I want to talk about the My SSP program, or the My Student Support Program. As mentioned earlier, due to jurisdiction issues, if you're not in British Columbia, we won't be able to provide you with services. However, all SFU students are eligible for this service free of charge. The Student Support Program is a free 24-hour, 7 days a week mental health support program for students. You can access any type of counseling or mental health support through the telephone, video, or through their app, such as chat functions. This is a great service, and it's available in over, I think, 30 languages. So you just need to call the phone number listed or download their app in the Google or Apple Store.
Thank you, Ricky. Now we will move on to our question and answer session. As such, I'm going to end the recording now. For those of you watching the recorded version of this session, thank you so much for watching and welcome to SFU. And please do connect with us if you have any follow-up questions.